It's but it's the majority of it. She brought up that they have something. She said something million.
Yeah, it was crazy.
Oh no, it was 17 months to spend. But it was like some crazy months. She encouraged. We don't want it to be directly to direct funding, or maybe for specific things. But if you so you can contract with the board, it's still what we realize.
Auditor can get
Yeah.
Yeah. Our supported. Yeah.
Yeah, that's okay, because this is something we probably won't bring it, but I'll put an email to the agencies later. Once I get here on who this. We feel too close together. Are you all okay with being like for one? Maybe. And then we're putting Matt way over there.
Okay. I mean, I might get a little chilly.
I have a sweater if you get cold. I know I won't, because at least 2 pounds.
I was like, well, I think the first, I don't remember if it was hot or cold, but the next meeting was the opposite. So I was like, we'll see. We'll see.
We had a board member this morning who had just returned from Italy this morning, or last night, and it was freezing in here.
Oh.
I guess we saw some relatives.
I think it's been common agreement on it. I know France could do that. They don't have air conditioning as much as we have here. Like, I think it's like 30%. Yeah, that's really low for the US.
Yesterday was 19 straight days. Over 150.
What? Why?
19.
I have a friend.
It's not audible. Jen's job, guess what?
Something good, I hope.
It's something good, county board input is all the way to the end. Okay. And this morning, Leah Taylor, like Secretary High Bar, she talked about, she encouraged agencies to speak to the county board directly about short-term funding.
Yeah. Yeah, she told me.
Top that.
Oh, she told me.
Okay.
And what I should have done is like ask for a verbatim thing to read, because that would be a lot better.
I could probably email you the text document from.
But I will encourage the same thing.
So what I'm doing today is trying to figure out exactly who the agencies should email for information. Like, I think Kathy Larson is your expert. but,
Yeah, Kathy is our expert,
but that might not be right, so.
Oh.
Steve had some ideas about who we should write to.
also Stephanie, did you say Stephanie?
No, he said Kyle and Leah Taylor and, Leslie.
Oh, okay. I mean, that makes sense too.
I
I
had
don't
some,
think there's a wrong answer here.
well, it could
We
be,
do talk.
like Kathy Larson could be the wrong answer.
Why? I mean, I think that she's not in charge of the actual, I mean, she's in charge of spending it, but she's not in charge of.
Jacinta, I set it up for you with water. Well, just because she knows so much about what is eligible and how to approach that.
Yeah, that's
Okay.
true. But
So Jacinta could use that one? By
she
water?
probably, she's never brought anything to us. You know what I mean? Like, she's not the one to kind of body.
So should I just go with his suggestion so far?
Yes, we just talked about it, so.
Okay. Then I know what to. I'll
And Leah knows way more.
I mean, it was great to hear.
Just fresh off the plane from Italy. She comes here with all that.
Mhm.
Oh, my.
Yeah. Yep.
No, we're good.
We do have a forum, but we have. I mean, you do have a quorum,
maybe
you
she'll
should start, but it's not like it's
She's gonna show.
And,
In this week?
and when you do start. Did you start to talk about the minutes or- Daphne? Stephanie, did you already advise?
What?
Did you already advise him? that you should vote to that kind of meetings?
Right after he calls it to order.
Is it, okay, I'm sorry, I missed.
Oh, that's.
So for this, what did we decide?
Because,
Make sure.
yeah, it might be early.
April.
I mean, I don't take responsibility for that too, but I don't. Because I'm not the official. Yeah.
Yeah.
How long were you,
Well, I had to do it.
So just, if anybody has. This is for the parent. This thing is-
And, you got a chance. They sustain.
I don't have that. Like, I would identify all of that.
Oh, I'm not meeting it, but and she's. I'll do that. No. They were trying to show. That's the whole bravery. Yeah, we get
All right, I will call the Champaign County Mental Health Board meeting to order. I know we have a member that cannot be here physically, so I will move for a motion to allow our, do I have to say the name specifically? So Maura, or Daphne Maurer to attend remotely. Do I have a second?
I'll second the motion.
And then can I have a roll call, please?
You can do it by voice.
Okay, all those in favor say aye.
Aye.
All those opposed say aye. No, seeing that the first voice vote, was approved, and we'll have more, Daphne, come in remotely. With that, we'll get a roll call for the meeting.
Here.
Here.
Here. Here.
Here. Here.
Here. All right, with that, we'll move on to the approval of the agenda. Do I have a motion to approve?
Motion to approve the agenda.
Second.
With that, all those in favor say aye.
Aye.
All those opposed say nay. The ayes have it. We'll move on to this mental health board and DDB schedules. I don't know if you want to comment on that.
I do want to comment on that. We always put an August meeting in tentative mode and then hope that we can get everything done in July, so we can take August off. So the DD board did do that, and they have chosen to not have a meeting in the August 16th at 9 a.m. But if you all are also inclined to cancel the August 16th meeting, but keep it and have a joint study session with them, we've got some ideas about getting some input from self-advocates who have DD, because that will help us build priorities for all three of the funds. So if you're agreeable to it, we'll change that to a joint study session for August 16th. And so I guess we don't really know until we get through this meeting.
They're not gonna be there.
So some of them are just going to attend virtually, but we're working on trying to get self-advocate input and some people who will present. So that's my hope, but it's not a done deal until you all get through this meeting and let me know. Okay, thank you.
Do we need to discuss that now then? If we want to keep that meeting as a study session,
I mean, I think
or should we just email you?
maybe we can talk about it at the end of the
Okay,
meeting
okay.
to see if you, and then just to let you all know. So there's some changes in the timeline, the allocation timeline too, and they are particularly to move the application system earlier. It will still close around the same time that it usually does, but this is to give agencies a little more time. We wanted to hopefully start the application system right, like a couple days before Christmas, so that they can use the extra couple of weeks. In order to do that, we have to move some of our other processes up, which means now to get you some ideas about priorities, so that we can then get your input on priorities, then get public input on priorities and get those finalized by December 1st. That sort of pushes everything up a little bit. So those are important changes in the timeline. And then we did learn from the last contract process that we had a deadline of June 16th or 17th for all kinds of agency compliance and contract revision or application revisions. And it was very hard for folks to meet that deadline, but we're going to stick with a similar deadline and just hope it goes better next year. There was just a lot of activity this year. The main upshot is people don't get paid as early if their stuff's not ready. So anyway, that's it. Sorry.
All right, with that, we'll move on to citizen input and public participation. Anyone in the audience is welcome to offer input at this time. We'll limit participation to 5 minutes. Is there anyone in the audience that would like to make a statement?
No.
All right, with that, we'll move on to my comments. I mean, basically first half of the year, we were working on funding agencies, and this half of the year and including this meeting, we'll be talking about focusing on knowing if what we're funding achieves goals that we set out and hopefully help agencies better track goals and set goals. So it'll be interesting to see the conversations we have with the new business. All right,
You
with
ready
that-
for me?
Yeah, with that,
Okay.
go on to your comments.
Okay, so one of the things that I thought would be great to have an August meeting for would be to spend more money if the revenue projections just kept going up and we had more money. And as it turns out, the revenue projection's gone down a little bit. So we have less by something like 24,000 less to spend than I thought we would. So later in this meeting, when you consider a funding request that we deferred, the recommendation is for like the full amount, but that's not going to work. So I would change my recommendation to a partial amount. We can talk about that when we get to it, but I'm just kind of sad this is it. So after this meeting, we will know all the things that you're funding for PY 24. And I think, given the amount of business, I'll stop talking now. Okay.
All right, we'll move on to the approval of the mental health board meeting minutes from June 21st, 2023. I'll give people a minute to look at that and see if there's any addendums or corrections.
Hearing no corrections or conversation, I make a motion to approve the CCMHB board meeting minutes from 6/21 of 2023.
I'll second.
All right, with that, all those in favor say aye.
Aye.
The ayes have it. The next item is the vendor invoice list on pages 26 through 40. I'll give people a moment to look at that. The nice thing is if you go to page 35, there's more details of the expenses.
This is a question not about this money exactly, but do we eventually get a breakout of the expo? Do we?
Great question.
Because I
Usually-
think we should have one.
well, typically that's after the fact.
Mhm.
So it's just an accounting after the fact, but
Mm.
Chris has taken the time to learn a function of the new county system. It's called project management. I don't know if you want to speak to that, but it allows him to flag them, basically.
Uh-huh.
Right? Is that right? So that, do you want to speak to it? Like we had to put all the expo expenditures into regular categories this year and take
Yeah.
them out of the distinct categories, which, you know, it makes it harder just at a glance to see what we've spent, but he can search it, right? Or I don't know. I don't know.
Oh,
how- Did I?
yeah.
Okay.
Well, that's why I was asking. I was looking down through here and thinking, wait a minute, I can't get a good full picture, but surely we get to do that later. And so just as long as it doesn't stay in this form forever. Yeah. So that eventually we can look at everything in the aggregate for the expo. Yeah.
It has created like just the change from keeping those lines distinct to lumping them in with other expenditures occurred, I think it occurred last year, but it's been kind of hard. It's been hard for us because things get like, for advertising, you've usually budgeted $200 for the, all of our needs. Cause it's really the only thing we ever did was like the NOFA, or like a job description or a job listing. But now all of the advertising related to the expo is going into that line. And so I have to have real clarity from them beforehand about what they're going to spend. And with the reduced revenue news, I actually kind of lowered what we're gonna spend next year. So I don't know, sorry to break the news, not a huge amount, but yeah.
All right. With that, is there anyone that want to move for a motion for the vendor list or any discussion? All right, I will move to approve the vendor invoice list. Is there a second?
No, second.
All right, with that, all those in favor say aye. Aye. All those opposed say nay. The ayes have it. We'll move on to staff reports. One question I had was, for the disability, expo, is there gonna be, when is there gonna be like a sign up sheet for the volunteer list?
Probably closer to like September and stuff. They didn't want to rush it too long because like, I don't even know what I'm doing Friday, let alone what I'm doing October 28th. So I would guess like after school's back in session, especially after the U of I is back in session, then I'd say first part of September at the latest, but believe me, you'll know.
Thanks, Jane. All right, if there's no questions or comments, we can move on to new business.
I had a quick question.
Okay.
Did Dr. Maurer end up joining the meeting?
Yes,
Okay.
yes, thank you for asking.
Do we need to officially bring her and Joe in with the roll call or no? Okay, just checking.
All right, we will move on to the UIUC Life Home Tour and Resources on page 61.
No, those guys are not in the meeting quite yet, but I will show you the page. Maybe that.
I was just interested to see what this house looks like. I'd never heard about this before.
I know, they'll do a virtual tour when they
Mhm.
join us. Should we, I'm sorry to take the agenda out of order,
That's
but
okay.
our second presenter is here.
Yeah, we could start
Want
with,
to flip it?
with that,
Okay.
yeah. So with that, we can go on, we'll go to the evaluation capacity building project on page 62 through 68.
Hello. I'm Jacinta Dariotis. I direct the Family Resiliency Center and am faculty at the University of Illinois. And so I am leading this capacity building project. And we thought it would be great to come and give a few updates that are preliminary based on our needs assessment that we have currently underway. As specified in the proposal, that we would start with a needs assessment and then go into the capacity building. A few of the themes that are emerging from our interviews with different partners and vested parties is number one, wanting additional face time with the evaluators to find out updates more frequently. So in the past, it may have been annually that you received updates. And so that's why I'm here. Hi. So you might be seeing more of myself and other team members so that we can give you some preliminary feedback as to how we're progressing and what we're finding. So that was one finding. So you'll see more of us and get some progress updates. Another theme that emerged was to actually obtain more staff voice in the process. So we are in the process of finding out what that would look like in terms of data collection for the needs assessment. And so we did have a meeting. We were able to participate in the meeting with the developmental disability and mental health executive directors a couple of weeks ago, and we're asking them how can we reduce barriers to having staff participate in a data collection effort to find out what their needs are, what their readiness is for capacity building and evaluation. And so we are thinking of having a group level assessment, which is a process that obtains data, but is not like a survey. So it's actually bringing staff together and having them generate ideas, having them analyze the data themselves so that they're interpreting it as well. And then from that, we would design capacity building based on what they're identifying as their needs. And so trying to reduce the barriers and burden on agencies to release staff time. And so that's the process that we're going through right now, is figuring out what's the best way to make that data collection possible and feasible to agencies. And another theme or piece of feedback that we received was agencies would like more information as to why evaluation and why this capacity building project. And so we are in the process of thinking about having a kickoff with agencies to explain this again. I know historically it's been stated, sometimes it bears repeating, but really thinking about why evaluation is important in terms of moving beyond what we would call monitoring and assessment. So saying how many activities one's engaged in, how many services, how many clients one is serving, that's all important information, right? That's outputs. That's really talking about the great work that's being done. And that narrative needs to be stated, but also taking the narrative to another level to say, what are the outcomes that are coming from those services? And that's really what evaluation is. It's like what works, for whom, in what context, and what additional data or information might be needed if the intended outcomes are not being seen to help move those needles in the future. And so just repeating why that's so important and why it's so important for agencies to have this capacity within versus having to outsource it all the time. So those are some of the major findings that we have found so far. Obviously, we're in the early stages of this project, so we just wanted to come and share that information with you. And if you have any questions, I'm happy to answer them.
I do. So you said, I'm trying to understand the flow of information here, because you said that you're working now to include staff at these agencies. Is that right? And is that correct?
Mhm.
Well, I don't understand how they weren't included. I mean, because were you just dealing with executive directors of each agency? Or?
So what we were doing was finding out from board members and others who participated in interviews what has worked well in the past, what hasn't worked well in the past, what they would like to see change in the future. We weren't part of what happened in the past. And so part of the voice was to center staff voice. And so because we heard that, we're making an increased effort to find out from staff what their needs are, what the readiness is, especially those who will be conducting evaluation activities and those who are in line to start collecting evaluation data and that type of thing. So it wasn't done in the past. It's more of centering it more now and finding a way to do it. So I'm sure you've engaged in survey research and data, and the amount of information you can get from that is sometimes limited. And so we're trying to take it to the next level to get more of a rich qualitative understanding of what some of those needs might be, what the ideas might be, taking it to the next level for what agencies might need from the staff perspective as well.
And my other question is, you said that there was another thing you were concentrating on is the question of why do this? You know, and that's another transfer of information question, because surely going into this, these agencies know that they have lacks that they can't. So I don't know how that message didn't go forward. You know, you're there because you're not coming up with the data that we can decide on your funding about, you know, or that you can decide, or that you can know what you're doing. So I find that very interesting and kind of puzzling.
I get that. I'm just reporting what we have found, but also sometimes it bears repeating. So sometimes if you think about it, you may have worked for an organization for quite some time. And you forget what your vision and mission statements are. Like, how many people really know what their vision and mission statements are all the time? So sometimes it bears some repeating and reminding as to what's that North Star that you're going for. And also, we're also finding, because there's been staff turnover and agency turnover, that when it was stated and historically, maybe that message, even if it's written in a contract or something else, maybe it's glossed over, maybe it's not been read, reminded of, and so forth. But also hearing it from a funder and others can have greater impact. And so because you've written it a certain way doesn't mean everyone's understanding it the same way as well. So I don't want to say or give the impression that it's not understood that evaluation is important, but it's like the why, what's it going to get us, where are we moving for, what are the expectations, so we can manage those expectations, especially because outcomes take so long to see. And sometimes that can be scary for agencies to say, we're going to promise on these things. Well, no, we're going to measure these things. We'll look at the timeline that it's actually feasible for, and then we'll look at that long term. So I think bearing repeating, even though it feels like, Groundhog Day, you're saying it again and again and again, right? This also happens when you're a faculty member working with students and the syllabus says it, and I said it here and I've said it there, right? And it feels like you've said it 1,000,001 times. However, sometimes it's a different way of saying it and who has said it that it clicks, or it gets that additional meaning behind it. So that's how I'm trying to approach it.
I think for me, I just see it as kind of the comparison to like the DARE program. Like, agencies may think they're doing something good because it feels good, and you think that intuitively it should be a good thing, but then you measure it out and you're like, well, it actually didn't make a difference. So, that's how I see this project going forward, is like, hopefully we can, obviously we're measuring like how many people they're serving, what they're doing, but is it helping? Is it helping the way we think it's going to help? And obviously, like, okay, well, kids are at the Don Moyer Boys and Girls Club, they're participating in after school activities. Yeah, it should hopefully decrease, them being out when their parents are working, so that they aren't on the streets, aren't, enticed to use drugs or get into violent or into fights. And hopefully they stay on task and do their homework, so they'll do better in school. So there'll be less teen pregnancies, there'll be less violence, there'll be, more graduations, going to college and getting jobs and having a thriving community. But those are things that we guess, that we hope happen. We don't know that happens. So those would be things that they could measure: graduation rates and going to college or getting a full-time job. And, so I think that's what I would see as this project going forward doing.
Yeah, I think to add on, in places where I've worked before, sometimes evaluation was seen as like figuring out if the people who are participating in the program like had a good experience, which is very different than figuring out, did we actually accomplish the things we wanted to accomplish with this program? And I think sometimes also evaluation, having been in the position of doing practice and doing research, it can be extremely challenging. And sometimes it just feels like a thing we have to do, and remembering sort of why we're doing it is really important, because then it's actually, I find it to be probably why I do practice and research, is because it can be very exciting to actually see that the things that we're trying to accomplish like actually met that outcome, and maybe some things that we didn't expect to happen happened. And remembering that can be difficult in the day-to-day of everything. So I'm glad that that has sort of emerged as an important piece of things.
Going back to actually Elaine's two questions, I'm curious to kind of merge them. Is there a little bit of an overlap of the Venn diagrams of the people when you're talking about the staff confusion and then that need for the why? I'm curious if there's agencies where you're seeing a lot of that layered on top of each other.
So we haven't gotten that far yet to do that. And so the process is thinking about doing this group level assessments, that then we can start to figure out which agencies have which needs and what readiness. And then we can think about how can we be strategic about doing that pairing, that partnering as needed as we move forward. So that part that has to do with the peer-to-peer mentoring and so forth might help with that, thinking about that Venn diagram that you're imagining in your head. Mhm.
One other comment that I just wanted to say was like on page 66, you talked about on-demand micro trainings. And I'm really excited to see how that develops. I think that's really awesome. And that just, just creates a nice resource for agencies, especially like you said, with the turnover. We've had a lot of turnover, especially in leadership in several agencies. I can think of off the top of my head is like Macy and Promise Healthcare and Don Moyer Boys and Girls Club.
New directors last year.
Yeah. So I think just having this build out as a resource would just be amazing. So I'm excited to see how that develops.
And so to also have the why you participate in this data collection with us right now is to get at what should those micro learnings look like, right? Rather than us coming down, top down to say, we think you should know about X, Y, and Z, it's finding out from bottom up to say, what are those needs for us to develop those? Mm-hmm. So thank you for your time.
I have a question. I'm sorry. I was trying to figure out how to work this. Hi. Where's your data coming from? I'm new to the board, so I'm new to learning about this. I'm kind of excited about it, but I want to know, I know you said you're using qualitative data. So where's that data coming from? I'm looking at this and I see your questions, but where are your outcomes? Where's your measurement coming from? I'm just curious.
So the data that we're collecting for the needs assessment and readiness assessment right now has been interviews, and then we will, so needs assessment is a process, seeing what has been before, what's currently going on now, what are the action steps to move forward. And so we're gaining that background information now from different, from board members, from agency leads. We're going to conduct the group level assessment because we think that that's the best way to go, and agencies seem to be amenable to doing that. With staff members, and then doing a survey with agency leads to find out what are those needs, what's that readiness. And then once we have those data to find out that information, then we'll start to design what the actual capacity building is going to look like. And then there will be an application process for different agencies to do the intensive one-on-one capacity building. So that's the beauty in the heart of empowerment evaluation, is saying, we're here to help facilitate the capacity building within agencies so that they themselves collect their own data and collect the data that they need to show their outcomes. And so that's what we are here for, to help them through that process so that they can collect their own data, and then they can build in the capacity that over time, if there is turnover, that's not lost, that they can continue to do that in a sustainable way.
You mean turnover with clients or turnover with the staff?
Turnover with the staff to continue evaluation efforts as they move forward. And also, because that's very important, not only for being accountable to funders, but also to establish additional funding mechanisms and streams. Is that helpful?
Thank you so much. Appreciate your time. All right. With that, do we have the?
Here,
All right.
yes.
So we will move to the UIUC Life Home Tour and Resources on page 61.
I saw that Samuel had joined the Zoom meeting. There you are. You ready? You can share your screen hopefully as easily as you did this morning. Good to see you again.
See you. Thank you. Hi, everyone. I will just share my screen here. Okay. Can you all see my screen? And can you hear me well?
Yeah, we can hear you well.
Okay. So My name is Samuel Olatunji. I was joined this morning by my Assistant Director of Research, Dr. Harshil Mahajan, but for some meetings happening this evening, he cannot make it, so apologies from him. So I will just present on behalf of the whole team. So I'm a postdoctoral researcher here at the McCartney Family Life Home, and I work as an engineer supporting all of the research activities happening here and maintaining the smart home infrastructure here at the Life Home. I will just give you a brief highlight of what the Life Home is, what it entails, what we do, and also give an idea of some of the research going on in there, and then open up to ideas of how we could advance the research, meeting the community and engaging the community as much as possible. So I'm going to start with the acronym LIFE. You see LIFE here, which is the full meaning is what you have over here, living in interactive future environments. And that is the idea of the Life Home. We want to simulate a typical living space where people can interact with technologies in different dimensions, technologies that are available currently on the market, and technologies that are research phase that we're looking forward to support people of all abilities and all ages as well. So that is sort of the life mission of the Life Home. It is a research center focused on innovations in home environments. So it mimics a typical home. It's a 2-bedroom flat. You do see the facade of the apartment. It's a 2-bedroom facility built as a typical home with all of these technologies embedded within it. And the idea is to see how we could adapt the technologies to meet different needs, diversity of needs, from those with different forms of abilities, different forms of physical or cognitive challenges, and see how we could use these technologies, adapt these technologies to help them live more independent, fuller, and even healthier lives. So inside the home we have, which I'll show you in a moment, we have different technologies ranging from human robot interfaces, telemedical devices, rehabilitation devices, and robotics as well that will support people of all ages and all abilities. Just a quick layout of the facilities, what you see here. Over here in the orange area is the home simulation space, where we have the living area, the dining area, the bedroom, and what you have in a typical home, the laundry part. And we also have like meeting spaces where people would collaborate. All of this is tending towards research, where we get to test different kinds of devices, different kinds of technologies, and also educate people on how to use these technologies. One of the interesting facts we share is a lot of technologies that we have currently, if you give them to the average user or even to an older adult or someone who has a form of disability, even unpacking that technology and getting to use it is it takes a lot of cognitive workload for a lot of people. So even educating people on how to use this device so that it doesn't just end up in a shelf or in a cupboard somewhere, that is part of what we do. And also meeting the public, engaging the community to inform them of what is currently available and how these things can meet their needs. So this is kind of the layout of what we have in the smart home technology area. And I'm showing you just a brief overview, just in pictures of the different spaces. So this is the home simulation area that I just showed you on the map. Coming in through the door will lead you into the living area, the bedroom. We have a den there as well. And we have some robots, which I'll talk about as we do the virtual tour. The kitchen area has several appliances that are all interconnected and can be controlled remotely. You control it in person, as you see the person in the picture controlling it by voice, but you could also control this remotely. So if there's someone with a form of disability and we have a family member or another like healthcare practitioner or someone who is caring for them and needs to control maybe the fridge or the dishwasher or the oven or the coffee maker, just control this remotely. All of this can be done via voice or through an application, even from a remote location. We also have other spaces within the home simulation area. We have like a walk, kind of working environment, or N we would call it, where we get to test different technologies. We have a small sized bedroom where we could also test technologies that would improve on quality of sleep, take different data and see how we could assess what is the pattern of sleep and how we could improve this over time. As I mentioned earlier, we are also keen on collaboration. So people from industry, from the community, or even faculty members at UIUC come here and do a lot of brainstorming. They use some of the whiteboards we have, the 3D printers, they do prototypes. We call it the health tech lab because we bring in people from healthcare, people from engineering, people from different fields of tech research to collaborate together and then get to test out some of their prototypes in the home simulation space. Just briefly, I'll highlight some of the projects that have been going on in the space, and then I'll just open up to questions after the quick tour with the robot. So one of the projects happening in the live home, which is still continues right now, is one of which we call the Fireplace Project. So this was a collaboration with a fireplace producing company, and they wanted to see the effect of an electric fireplace, which had some additional features, to see the effect of that on overall well-being, especially on the mood of people over time. So it was an extensive user study where they bring in people to sit on this chair, they play a game, they do some other things, activities, without typically or specifically mentioning that there is a fireplace that they're studying, just to see the effect of that on people. And then they took several measures like heart rate readings, and also other like measures to just see what was the mood of people over time. And from the results they're getting, we found out that some of the features they included actually contributed to lower stress in people when they are sitting in front of the fireplace. Just an example of some of the technologies that were brought into the life home. That is a collaboration of the university with other researchers as well as industry as well. An example also here is a robot that we are still working on that is supposed to support people with visual impairments. So this robot is in collaboration with another company that produces just general multi-purpose mobile manipulators. This study was a study that was conducted as a needs assessment initially to understand the needs of people with visual impairments. And now it's at the prototype stage where the robots can lead people around the home or even in a bigger facility. So the user could tell the robot, take me to the bedroom or take me to the bathroom or any aspect, only any area of the home environment, or even a bigger facility like a healthcare center. So that is also currently being developed right now. And maybe one of the ones I would like to also highlight is the stretch robot research. And this one is a small business division research grant from NIH. And the focus is on improving a mobile manipulator like the one you saw previously right now, to support people with physical impairments, but also cognitive impairments to support their independence. So this is a collaboration between the university, another industry partner, and Clark Lindsay Village. And the idea of having this robot in the home space here is to try it out in a typical home environment and see how it meets the needs of people. So we have developed some tasks that the robot, we have developed the robot to carry out some tasks, and then we bring in participants from different walks of life to try out the robot and give us ideas and their own perspective of how the robot should interact, should carry out these tasks. So in short, we show them the potential of the robots, and then they get to tell us what the robot should do for them, and then we get to improve on the robot. And the plan is now to take it to Clark Lindsay Village to try it out in that environment to support the staff there as well. So just a quick highlight of some of the projects happening in the home space. And finally, I had mentioned earlier that we really love, one of the mission is to engage the public as much as possible. So we do have visits from community members who want to learn about the facility, learn about the technologies. Some of them get to try it out. We do focus groups, get to learn from them. Some of them join part of our panels and boards that help us improve on the technologies and the research. And we also conduct a participatory design. That means they come in at the stage of development, even the brainstorming of the problem, creative problem solving together. They get to test the prototypes up to the point of even co-designing it together. So, and that has led to improvement in a lot of the technologies we have. So that's just like a quick highlight of what we do. I also just as a wrap up wanted to give you a quick tour of the space with the robot. So, okay, maybe just a quick, just backing up to this. I did show you this picture of one of the, I think it was a company that visited some of the people that visit us, but one of them could not make it that day. So we put the person on one of our robots, which is a 30 presence robot. So the person has a link through which it connects into the robots and can drive the robot around. So as we're going about this tour, taking people around, we were able to also give the person an opportunity to see the space. And that's what I'll be using today for the short tour. I'll be putting all of you now through the Zoom onto the robot, so you get to see the life form through the eyes of the robot. So I'm taking these out right now and logging you into the robot. So this is the front door that you saw in the picture. And then I'll just move around the home a bit and just show you some of the spaces that we talked about. So this is the fireplace room, where we conducted the study to see the effect of the fireplace on overall well-being. And just beside it is the bedroom, where we get to test different technologies that support quality of sleep, and also to take different measures that we could use in assessing the pattern of people. So moving into the bedroom right now. Bedroom, you do have different sensors. So we have sensors under the mattress that take heart rate readings, sleep patterns, sleep length, and also these pillows are smart pillows as well. So we get different types of readings just with the sensors in this room. Time will not permit me to look through the other sensors. We also have occupancy sensors to know if the person even got up from the bed, if there's someone in the room, activity level in the room, and all of that. And over here is a one-way glass, which I think I can show you more of here. So we do have in the facility, let's get out of the room. We do have this one-way glass where we get to observe how technology is being used in the home space. So we have several experts in not just engineering or other aspects of healthcare. We also have human factors experts that help us like observe what is happening in this space without interrupting the interaction between the humans and the technology, in that just to get feedback that can help improve this technology. So some of what you have in the space are some social robots that are also mobile, that can go around, that you can also connect to remotely, that can give medication reminders or even deliver items for people. We do have also sitting on the table that you're looking at on the dining, another social robot that can support people with who are going through social isolation. It's like a pet robot. So you can pet it, it can communicate through the screen here. It can do FaceTime with other members of the family or friends who want to communicate with them. It's a very active robot, as you see, moving, checking out what's moving around. And over here is the other robot that you saw in the PowerPoint that we use in delivering items. So it's a mobile robot, it has a gripper. So here we're testing it to pick up a medication bottle and deliver to a person. So this can be controlled remotely, but we can also program it to do things the way the user would want. So we have like user-defined autonomy that can be programmed into the robot. So right now we are testing it in the home environment. You see the different kind of tasks that this could do for them. I didn't show you that we also have on the ceiling here, on this point upwards. So on the ceiling, we have these cameras with which you can take data of what is happening in the home space and use this to improve how the technologies interact with people, and also how robots like this would navigate around the home space. So we get a lot of data from those cameras as well. of course, when we bring in participants, they have they decide whether they want that data captured or not. So we usually get their consent on that. So coming into the kitchen area, just wanted to show a little bit of what we have as I showed in the picture. So we have smart technologies that are all connected, and some of these, most of them can be controlled by voice. So if you have people with physical impairments that for one reason or the other, they couldn't maybe open a fridge or check what's in the fridge, they can just talk to the fridge. So I'll just maybe try that right now. I hope it works. Hi, Bixby. Hey, Bixby. Show me what's in the fridge. No, cool. Okay, so right now, I'm hearing some echoes, so I guess you didn't hear me well, but the idea is you could talk to the fridge. It has a tablet on it where it will show you what's in the fridge, or even suggest different dishes or recipes based on what you have in the fridge. You could be in a grocery store or somewhere, you don't remember all that you have in your fridge. Give commands like that, and it will be able to show you, even on a mobile tablet, or even on a phone, what's happening in the home space. So these are some of the technologies that we have in the area, and they are all interconnected. So you get to control them even through digital voice assistants like this. And in general, we try to adapt these technologies to meet the needs of people with different forms of impairment. So we're going from people with mental or physical or mobility impairments to even people with visual impairment, as I mentioned earlier. So that's kind of a brief overview of the space. And I will stop right now to open up to questions, as if there are.
So I guess from a medical perspective, what kind of medical capabilities does this house have? Like you said, telemedicine in there. But I know like at Loyola, for example, they have in their ICU a computer that the nurses will wheel around to patients when the ICU doctor's on call that has a stethoscope attached to it. So they can put it on the infant's heart and listen to their heart and their lungs. Is that like a capability that you guys have other than telemedicine for psychiatric stuff, or do you only have telemedicine for visual purposes?
Okay, thanks for the question. I didn't have the time to show you other kind of technologies that we have, but we do have a telehealth robot, and interestingly, I don't have it here, but we call it the Salt Robot Project, and that is a robot that has the capability to be connected to remotely. It does have at the end effector, like at the arm, a softer part, which can be used to either hold a stethoscope, as you said, or even check maybe wounds or any sore place, or just very, very, very skin friendly. And that's the essence of putting a soft part on the arm of the robot. So the healthcare practitioner or whoever wants to check on the patient could remotely control the robot to the location. Maybe it's the bedroom, the person is maybe recovering from surgery, and they could get to check different vital signs and also get to check maybe wounds with that soft part of the robot. So we do have some telehealth, a particular one I remember right now is a telehealth robot, but we do have another one that could do something similar as well. And that is all currently being tested. And we have in the facility outside of this home space, just if I step outside that door, we have a room which we call the tele-research room, where we get to test the technology as if being remotely connected, as if you're remotely connecting to robots in the home space. So we change the network there, change all a lot of parameters in that room, just to simulate a situation where someone is connecting from a different location, from a different network, in a different atmosphere, and then see how best we could get to visualize what's happening in the environment and the ease of controlling that kind of robot from a distance. So I think telehealth, the telehealth robot we have, which has a soft arm, is the one I would say would fit into that category you talked about.
Hi, I have a question for you.
Yeah.
Mental health, you mentioned the mood with the fireplace, and I think as you were presenting it, I was wondering more about that because I don't understand how that's different than someone just sitting in a fireplace in their home. I didn't hear anything about measuring mood, so I may have missed that. And
Okay.
that's the only aspect that I heard about mental health. So I'll give you an example. You have some technology in the bedroom that'll measure something that you said in the pillows in the bed. I missed it, but is that also related to mental health? For example, sleep,
Okay.
night terrors, things like that. So what part of this also includes other aspects of mental health?
Okay. So I'll maybe start with the fireplace, this one. So this was a study that started about this time last year, and we took a break right now because we're trying to improve on it. The idea is to critically examine if some of the effects they put in the fireplace has any impact on people's mood and stress level over time. So what they did is to have different conditions where the fireplace is on or off and certain features are on or off, and to see how this affects people's responses to different situations that they were trying to test in the home, in that environment. So the people sat in front of the fireplace and they told them a story. They had different scenarios of conversations that while they were not really conscious of whether the fireplace was on or off. And then they got to deduce by just doing analysis whether the effects they put into the fireplace had any impact on their stress level over the period they were in the space. I don't remember specifically, it was like a 2-hour time or maybe a little bit more than that. But in that time space, they were able to confirm through the research that went on that some of the effects of the fireplace was to reduce their stress level over time, and also how they responded to different scenarios that they presented to them while they were sitting in front of the fireplace. So I think part of what I remember reading from their output was people recounted more positive experiences. I think they asked them questions about some maybe past experiences. People recounted more positive experiences when the fireplace was on, but when it was off, there were a little bit more of the negative things that were coming from their responses. So it was quite interesting, the output that came from that. And they're still designing another study currently that will test out more of the effects of maybe a crackling sound in the fireplace, or even the temperature and the ambience of the room changing. So all of that is being tried out right now. But at least from the preliminary results they got, they did see some impact it has on the stress level over time. I would say regarding the bedroom, which I showed here briefly, we do have, as I said, sensors that take a lot of data, including heart rate readings, sleep quality, sleep pattern, and a lot of other data that can be analyzed together to understand what is the sleep quality of people over time. That works through the sensors lying here on the bed, which can go under the mattress, and the pillows as well. So the pillows are smart pillows that can also simulate certain sounds or also play certain music that can contribute to relaxation that will help people sleep better. And then we tend to assess how that impacts their sleep quality or sleep pattern over a period of time. So those are some of the sensors we have in this space, especially on the bed and on the pillow. Not really mental health experts, but some of the data that is coming from those who do the research have been, working on that and seeing how that could improve, quality of sleep.
Well, that brings up a question about psychological dependency on a house that does that much. And science fiction has already gone I'm sure you know, there's a
I'm
famous story about a smart house that takes over everything. But I do wonder about that, both psychological dependency and in the terms of isolation. If
Yeah.
sounds wonderful for people who have, disabilities that this house can help with. But aside from that, if you've got a house that it cocoons a person that much, I wonder about the possibility for people becoming, isolated by that house. I just wonder if anybody's looking into that.
I can share a little bit from my own research on understanding the balance between assistive technologies supporting people and still allowing people enjoy their independence, different from while the assistive technology supports them. So my core area of research is in assistive, sorry, I just want to switch this off real quick so it doesn't echo. Okay. So my core area of research is in assistive robots, mostly socially assistive robots for healthcare. And part of what I investigated previously is seeing the balance between the autonomy that we want the assistive robots to have. A lot of people want the robots to do everything, take care of the dishes, take care of the laundry, clean the floor, hand over this item, do a lot of things. At the same time, want to ensure that people are not totally dependent on this and then lose skills, lose their motor functions, lose what they would usually do. It reminds me of one of the ladies I met who came, she was about 98, and I was trying to even help her with a walker that day. And she said, no, you don't have to help me with all these things. Once you take out this part from me, I begin to lose my motor functions. I don't get to do things anymore, and I depend too much on all of these assistive devices. So what I did in my research is to try to find that balance, show capabilities of what the robots or the assistive devices can do autonomously, and then interview the users, talk to them, and get feedback from them of how much they would want the robot or the assistive device to be involved in their lives, and try to strike a balance and aim towards what I termed like user-defined autonomy. What part of my life do I really want this robot or any form of assistive device to support me in? And what do I want to continue doing because I like it, it helps me, it supports my health, it's good also physical exercise every day. I want to keep doing this part. But this part of my life, this part of my interaction, I want the technology to support me in that. So we don't want you to tilt towards the side of manually doing everything because that's still a lot of physical workload. At the same time, we want to define it to a point where it just supports them, but does not take over their lives, does not, that they don't become too dependent on these things. So that's an area that I'm still working on, more of user-defined autonomy so that the people can still enjoy their independence without being fully dependent on this technology.
Thank you.
Any other questions? All right. Thank you so much for your time. Really appreciate your presentation.
It's a pleasure. Thank you. Thanks for listening. Bye.
All right. With that, we'll move on to the IDD Special Initiatives Fund on page 69.
So what a coincidence. You'll think that perhaps I had something to do with the agenda. So we do, as I mentioned earlier, we have to start developing, if you're going to use the Special Initiatives Fund to contract with agencies for starting July 1, 2024, we have to start defining that structure now. You and the DD board could decide together to do different things with the fund. It's for short-term projects because there's about $800,000 in that fund. When you spend it down, that's it. The only revenue coming into it is through interest income. There is about $6,000 that's reserved for one individual, like a trust fund that was deposited on his behalf, and we still manage it. But hopefully that'll be spent down soon. I haven't heard from them in a while. So anyway, it's not a lot. It's not a lot of money compared to the DDB fund and the mental health board fund, but all three funds have a responsibility to services for people with developmental disabilities. So interestingly, our last presentation took about a year to get. This was recommended to me initially by a former county board chair who everyone in this room knows, who toured the house and said to me, you have to show your boards because this could help people with disabilities. I wasn't sure how. And then in February, I saw a presentation from the state of Ohio where they do everything so much better for people with developmental disabilities. It's partly because they spend the money on it. It's partly because they have a county run system so that boards like yourself actually have some authority over what happens with state money in their communities. But Ohio had an executive order, I think, to use technology first. If there was some technology that could lead to people being independent and successful, that should be explored before staff support. This is a partial answer to the staff shortage, but it isn't. So like you won't find anything in this memo about new threats like AI, data poisoning, the reality of surveillance, or the fears about surveillance. Like, I think those are all real factors that were not included in the research that I've seen so far. But so there's some, I updated this document from the last set of priorities. I updated the context parts and the timeframes, but I only very lightly touched the priorities because I think that input from you and the DD board on what to do with this fund could change those sections dramatically. So you'll see like same priority categories with just some updates, but that context is a little different. Here's the stuff about Ohio. It's immediately followed by research on isolation and loneliness, because I think that is a threat. Cost is also a threat, but what was interesting in the Ohio project is they found that they could use off-the-shelf technology that was actually really cheap to help people rely less on staff in their group homes. And then the surprise finding in the research, this will surprise everyone, is that the people who lived in the group homes there didn't like seeing their staff show up. They were like annoyed when staff showed up, because, you know, and staff have to show up sometimes. So that was kind of a nice result, but I do think those other threats are really real, especially social isolation. So we also have in the state of Illinois some horrifying examples that made the news almost every day for the last couple of weeks about abuse and death in our state operated developmental centers, which are where we put most of our money for developmental disability care. So maybe we're not doing great by a staff focused system. So maybe there's some potential there. I don't know, but I wanted to share that, and I wanted to get you all like acquainted with the project because it's right here. Maybe there's some potential, maybe there's not. But anyway, so this memo really is to like set the stage for if you want to do priorities in the same way that you do the other two funds. It might look something like this, and you can see the priority categories are lightly touched. And then when we get to overarching considerations, I feel like that is also connected to the discussion that we had with Dr. Dariotis about the evaluation capacity building, because when people say, why do we have to do the outcomes work? I think the answer is that you are a government unit. You are spending public money. You have an obligation to the public to purchase the best value. The best value is made of complicated things like financial clarity, which we've been talking about how difficult it is for agencies to do that now that they don't have great access to financial professionals as they used to, and the cost keeps going up and up. That's one part of best value, but another part of best value is demonstrating why we do it and whether it's working. And that's the whole outcomes piece. So I feel like, given the conversation you all just had with Dr. Dariotis, what she's finding and what the DD board engaged this morning on the topic, I might really rewrite these sections to kind of bring it to a more simple explanation of what is a best value, you know, because I feel like if the agencies aren't sure, that's not a good sign. So, you know, I'll do what I can to clarify. I always really value input from the board members on the details of these memos. So if y'all don't mind, I might like to share this memo with you, and then you can give me feedback in the coming weeks about what you would rather see, and hopefully you and the DD board will be moving in the same direction on this. But the other thing you can do with the special initiatives funds is hit pause. And this one is not as critically important to, like, if you want to do contracts July 1, we kind of got to get it rolling. But the traditions of the mental health board fund and the DD board fund to be contracting by July 1 are probably more important to this, maintaining the system of services that we have. And the special initiatives fund could be used a different way, like maybe RFPs for particular projects. So anyway, I'm sorry to talk so long, but that's the whole deal there.
Any questions, comments? I mean, I think that all I would say is, you know, I think we're kind of stuck with technology possibly isolating people. Even obviously the biggest example is probably the internet. You know, it connects everybody, makes everyone isolated from each other. The more you're on social media, the higher the rates of anxiety and depression are for people, adults and children. But at the same time, you know, the state doesn't allow us to pay the DSP workers enough to provide them with the security and safety for them to feel like they're going to be able to pay their bills. And so the quality of care and increase in burnout, or the quality of care diminishes and the increase of burnout increases because of that. And so I think you have to, you know, solve that problem. And I think quality of care increases when you decrease the stress of the employee, so providing that care to that population. But I think with the initiative, the special initiatives fund, I think, you know, we'll have longer discussions on what to do. I think the next meeting, if we meet with those advocates, will give us a better idea of where we should be spending that money. It's hard for us from the outside looking in to know what is the best use of that money. I think they will probably give us a better insight of how to better use that, how to best use the money.
Okay, I'm going to try not to ramble on too long. So some of you on the board know that I did work with individuals with developmental disabilities. And, you know, I've always said the pay then was terrible. The respect then was terrible. And it hasn't changed. Earlier today, I spoke with Lynn and I said, you know, another good one bit the dust. So my 21-year-old daughter gave her 2-week notice to an agency because she felt like she wasn't appreciated. She felt like management really didn't care when she'd come to them with, I felt some significant concerns. She applied at kind of like a private Alzheimer's, you know, facility. So very bougie, as she said. She's going to make $1.50 more. And she told me, you know, Mom, I'm not a CNA, so I'm not allowed to give pills anymore. I won't be giving them baths and things. And I'm like, wait a minute. So what will you do all day long or all evening? And she's like, yeah, you're right. Play bingo, paint nails, watch TV and talk. When she was running around feeding them meals, making sure 6 people got bathed, 6 people got meds, you know, making a grocery list, you know, running a little house. And so, you know, I give her kudos, and even some of the kids in that generation, you know, I just sat back and took it. And she's like, you know what, I'm going to see what's out there that's going to pay me more. Not that she doesn't want to work hard, but she's like, Mom, I'm so frustrated. And so, you know, I love the idea of offering more money to these individuals, but it isn't always just money. And she even said that they had a situation and another house manager said to her, I can't believe your house manager didn't beg you to stay. He didn't offer you any incentive. And she said, no. And she's like, you're probably one of the best ones we have in this agency right now. And so, so I'm a proud mom, but yet I'm like, the cycle continues. I did this in the mid-90s and here we are 2023 and my kids going through the same frustration.
Yeah, thanks, Jane. I appreciate the comments. With that, we'll move on to old business. We have the deferred allocation decisions for PY 2024 on page 83 through 88.
So the first several pages are context. Then we see you had made three deferrals and then one denial plus a recommendation for deferral for special initiatives funding. And we have results for most of them. So the first one was the Chris Healthy Aging. We staff did reach out to them about, this was denied for mental health board funding. It was a mental health application, but had a piece that related to DD. And so we asked them if they could revise the proposal to be 100% DD, and they said no. So they may apply for this program next year, but they chose not to. It was a lovely response. I was kind of surprised, but so that one you're done with. The well experience was deferred for audit results, and that audit is still not available. We had a meeting, Leon, Bryson, and I think that's right. The two of us met with the director a while ago, and she understands that it could be that there is no mental health board funding available for PY 24 by the time that audit gets done. So she said it first, and I, at the time, didn't think that was how it was going to go, but that is how it's gone. And I'll explain that in a second. Urbana Neighborhood Connections is a much smaller grant, and that audit, all the pieces of that audit came in. They answered all our follow-up. Well, there's still one follow-up question that we're working on, but the audit requirements were met. So pending that other follow-up, they're working on that. But she also said, I would prefer not to contract with the mental health board because it can't keep up with these requirements. It's been very stressful. So that's not, I don't think that was a surprise to us. It has been stressful for that director, her mother, who was the previous director, and the director, the interim director. So for the amount of money they were getting, it was too much. So I love their work, but they're not asking for consideration. Finally, Women in Need Recovery did deliver all the pieces of the audit, answered all the follow-up questions. This was an excellent application with no problems at all. So they are ready for you all to consider funding. When I wrote this memo, which was a week ago, I thought you would have enough money to do this. On Monday, I learned that our property tax revenue projection is lowered. This is the first time that's happened in 7 years. And that's also a warning, because in the future, consumer price index is not expected to increase like it has. So we're probably done with the years of steady growth. So this is what I think that is affordable right now is $110,000. That allows you to move forward with a balanced 2024 budget right now. There may be other changes in the projections for next year, but I think we have talked, we agreed it was responsible to stay balanced while we can. So I would like to change the recommendation I've made in this memo. And I did consult with the director of this agency and said, we can't afford to do the full request if we can do a partial request. Are you still interested? And she said, absolutely. So that's, if you want to know more about the budget changes, I think that we will do that in detail in September, because that will give us time to get solid updates from the county. That gives us time to get feedback from the county board as well. So anyway.
Excellent. So I know that was a lot of information. The only other thing I would add is, when I was talking to Lynn about it, I was also commenting that, I think it's also only fair that, they share in the pain that all the other agencies that applied and were able to get everything done on time had to share. And so I think I would hope they would be fine with it, which is great that they are and able to utilize the funding if we all agree on this. But I also agree with the 110,000, but I'll open it up to discussion to what other people's thoughts are on this. I know obviously if we fund this, we won't be able to fund the well experience program. So.
At some point we have to allocate that. At some point, we do have to allocate that funding though. And I know that we've wanted to be very considerate of all of the obstacles in the way of the agencies that we fund. But at some point we will have to make a decision. So I'm not necessarily advocating that it's time, but I do want to just put that out there, I guess.
Did the well experience tell you when they would have things done, right? There wasn't any specific timeline, right? Yeah. Yeah, and I think, it's middle of July, I with no definitive timeline on when the funding or when the audit and everything would be completed and all their ducks would be in a row. I think, waiting any longer would, from my perspective, wouldn't be appropriate in delaying or not appropriating that funding to other agencies where we have everything already done, given it's past 6 months into the year already. So I am fine with funding 110,000 for the WIN recovery home. And I can move for that motion, but if anyone else has any objection or any discussion or any comments prior to that, I'm open to that.
I'm just very disappointed that the projection went down, given like how much need agencies are having and our community is having right now. In a year when the mental health board was called upon for more, now we're kind of stuck, and it makes it, I think WIN Recovery is an excellent program, and I will definitely vote to allocate them this funding. It's very painful that it's come to this place that we can't consider this last agency that we're waiting on because of these allocation changes.
And I think when I was a newer board member here, I didn't understand that all the funding has to be used that same year. That never made sense to me, because logically the years where you would need that funding the most, you're going to have it the least. And it's like, you should have a rainy day fund, and you should have that, like, just so that okay, when there's a downturn, when there's a recession, typically every 15 years there's a downturn, you have that money allocated so that we don't run into situations when we need that money to fund agencies that we can't. Because obviously I wasn't here during that time, but there was a time when there wasn't funding for agencies, and a lot of agencies went away, and those agencies don't come back. When those agencies are gone, a lot of times they're gone. And it's a huge disservice to the community and to the people that they serve. And then just trying to rebuild all that again, it takes so much effort. And then by the time you do that, you run into a situation where there's another downturn, and you're right back where you started. And these people put their blood, sweat, and tears into these agencies. And obviously, it's great for all the work, all the improvements they make into the community, but also just to let them down at a time that they need us to help pick up some of the slack. It's kind of disappointing, but yeah, I think we're doing a great job in trying to divvy up the burden of or financial hardship that the agencies are facing. So I think this is a good way that we've done it this year. And I think, I'm really happy, especially like with races, for example, just being able to fund them and keep them afloat we've done a good job in trying to keep as many agencies afloat as we can, with the resources we have, so.
Well, that's why agencies need to start founding endowments. And we had this discussion because there were people who said, well, this agency has got money in the bank, so why should we give them anything? But they need themselves to have that rainy day fund, because we can't do that for them. So.
All right.
Well, and
okay.
one little thing, I think if we were to say, oh, let's talk about this next month. I mean, we kind of keep kicking it down the road a little bit, but also I feel like, does that kind of say maybe give a little bit of hope to the well experience when we know that we can't fund them the full amount? And if we do fund them a partial amount, then, when doesn't get their 110? And is that fair? So it's just, it stinks being in these seats. So, it's a hard decision, but I don't know. I think you made a motion and I'm willing to second that motion.
With that, I'll move to approve the CCMHB funding of $110,000 recommended for wind recovery community support reentry houses, subject to the caveats as presented in the memorandum. And then, do I have a second?
Second.
With that, is there any further discussion? Seeing none, can I have a roll call, please?
Matt Hausman,
Yes.
Lisa Liggins Chambers,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosaye,
Yes.
Elaine Valencia,
Yes.
Jen Straub,
Yes.
Jane Sprandel,
Yes.
John Paul Yoking.
Yes. All right, with that, we'll move on to the quarterly update on community health plan.
No, I might have.
All I'm doing is I'm trying to share the screen, but I can't get to it because of the closed captions. That's all. But you have it in your packet. I feel like I might have missed a page. So this is the, did I miss a page? Nope. Oh, okay. I didn't miss, oh, thank goodness. So I only included it like y'all and the DD board support us participating in this. The idea is, okay, the mental health board, but not the DD board, has a statutory obligation to do a 3-year plan. And prior to the 3-year plan, a community needs assessment. The same obligation exists for the healthcare providers in this region and public health, although that's actually, it's no longer a requirement, they just do it. And United Ways. So as a group, Champaign and Vermilion County United Ways, mental health boards, public health districts, and healthcare providers work together on one community needs assessment, community health needs assessment. It does always include behavioral health. It doesn't get very deep. So our staff will still do an additional assessment specific to behavioral health needs. That's often like a literature review or collecting other surveys. That this is a very over-surveyed community, partly because of the university, partly also because of the 350 nonprofits and all the government organizations that do social services. So we try not to over-survey. What's missing is often the voice of people with intellectual and developmental disabilities who actually do use healthcare and behavioral health services. So I feel quite lucky that on our behavioral health work group for this project, we have a bunch of people who provide services to those with DD. They're participating in that behavioral health work group, and so that we may be able to include folks in the surveys who, not only people with mental health and substance use disorders, who are often like not willing to participate in the survey, but also people with DD. So anyway, it's just in here because that's the update from the coordinator about what each work group is doing toward each priority. Just thought it would be interesting for you to see it since you're paying for it and we're participating in it. And you'll mention sleep when we had the presenter before, and I have made a big fuss along with some public participants about sleep when we did a hearing on these priorities, and it got to obesity has been identified as a priority. And there was a big group of people who said the answer is not your healthy eating school, like classes. The answer is sleep. And I was like, I mean, there's a connection between sleep and inflammatory diseases too. And depression is an inflammatory illness. So I think it was wonderful that you all asked about that sleep, and maybe we'll get this group to do that too. But what we have in this group is a little bit of like institutional impact. Like we want to keep measuring the things that we know how to measure, right? And instead of sunsetting them now that we know they're meaningless. So anyway, just an interesting detail.
Yeah, I know in the past, there has been discussion about starting high schools actually later in the morning so that teenagers can actually sleep and get better sleep so they can focus better in school and be less irritable. But yeah, definitely is very important for a lot of things.
Are you going to sleep? No, Joe.
Yeah, Joe's going to sleep. Yeah.
Thank you, Joe.
Any other comments, questions? All right, with that, we'll move on to agency input. If there's any agencies present that would like to participate, we'll leave your comments to 5 minutes. Just message in the chat or raise your hand.
There's so many in there. I don't see any raised hands, but we do have a lot of online participants.
Okay. If anyone raises their hand, we can go back to that. Right now, we'll go on to board-to-board reports. Do we have any board-to-board reports? No. Seeing none, we'll go on to county board input. Any county board input?
So Lynn would like me to say, and we've talked about it a little bit in other meetings. Most of the $41 million that our county received with the American Recovery Act, or ARPA, has been delegated at this time. However, a fun thing that I've learned is that having money and understanding what the priorities of our community or our county are is one important step. Getting that money spent in a very compact amount of time is a whole other challenge. And so although that money is delegated, what we're coming across is that some of the agencies have been able to spend only a part of it or have, canceled the project or many different things. So smaller organizations or agencies or individuals should still feel free to approach the board with an organized plan. It may not work. We may not have the funding, but if we do have the funding, a priority is definitely to spend all of that money in our county rather than have to then give it back at the end of the time allotment to the federal government, because we know that there are very strong needs in our county and we would like to see it spent here.
So hopefully all the agencies heard that.
I will email tomorrow with the correct contact information.
Kyle Patterson, PH. No.
All right, with that, we'll move on to the Champaign County Developmental Disabilities Board input.
Oh my goodness. Okay, so I think I told you everything that they did at their meeting this morning already. And they want to have a study session with you in August, even though some won't be able to participate in the room. I think virtual participation in a study session is a lot easier. So anyway, Yeah.
I mean, I think that's a great idea. I'm definitely open to doing that. I feel, I don't know if everyone else is in agreement, so we can just say yes and have you just change that schedule. Is
Got it.
everyone okay with that? All right, I see a
Yes.
bunch of nods, so I'll count that as a yes. I don't think we need a vote on that, so.
Got it, nice.
Oh, do we need do we
No,
actually need a
you-
vote on that?
No, you
Oh,
don't need to vote.
I didn't
on
think
it.
so.
I'm just saying, because Stephanie is
Okay.
in charge of making sure the county knows about our changes. So
Okay,
we're good.
all right. With that, we'll do board announcements and input. Is there any board announcements or? All right, with that, I'll move to adjourn. All right, see you guys next month. Enjoy the summer.